integrated health services. We offer various health and wellness and incentive programs to our clients. And today, I'm hoping we can spend a little time talking about one of those areas, which is our focus on nicotine education and cessation efforts, and also vaping. Why is it important, or what would be the selling points to have someone come and join our integrated healthcare clinic? So either DT or Cheryl.
When we talk to clients, we want to make sure they understand it's the full wraparound care that we as providers can talk to their Greater Nashua providers and their Lamprey providers to make sure we're all on the same page and make sure they're all getting the best care possible. So that's really important for the clients to know, and I think they enjoy that. It's if they don't remember something, they can either reach out to myself or somebody on their treatment team to remember where their certain referral went to or where they have to get labs drawn and things like that. So I know the clients really enjoy that aspect of Integrate.
Great, thanks. So you actually can coordinate all of their services under one roof.
Right, exactly.
I wish my doctor's office would do something like that. DT, do you have thoughts on this?
Hi, Sheila. I absolutely support what Cheryl just said, and I want to second that. It's extremely beneficial when we have a holistic approach to healthcare, and that includes, and not limited to, doctors, but a whole spectrum of specialists, case managers, colleagues on the team. It's extremely important that we work together. Some people might feel uncomfortable seeing us talk to each other, but it's about trust and developing that trust. Sometimes we bring information and resources to individuals and the community we're working with, and they find it's a more comfortable place to get that. It could be a church, it could be a senior center, it could be a center, any place that individuals interact. We can serve as a bridge to do that outreach. And again, it's not limited to just being in the office in our workplace. Process can be a very lonely journey for individuals. There's not a lot of available resources in ASL, American Sign Language, or support groups. There might not be any. Too often people quit on their own and go through that journey on their own. They may experience withdrawal symptoms without knowing what it is or what it means, or they are not successful in being able to stop using. And that is a frustrating thing to hear about. So providing linguistic and culturally competent resources is a huge, huge thing of what I do.
Yes, and I'd like to build off of what DT had mentioned about, the quitting process being very lonesome and the withdrawal symptoms. And I know in our population in particular, withdrawal symptoms from lessening or quitting smoking can sometimes be confused with mental health symptoms increasing. So as you said, Sheila, providing a lot of that just initial education to the clients if they are a smoker, whether or not they're ready to change or they just, want to know how their smoking habit or vaping habit is impacting their health. Providing them information about I would say facts and myths about what is withdrawal symptoms and what is symptoms of mental health. And when it comes to withdrawal symptoms, that's something we can help with. We have medical professionals here that can assist with medication assistance to make that process more comfortable for them. We also have access to, the nicotine replacement gums and lozenges and patches. And also, above all, I would say my role as the wellness specialist would be to meet with them either over the phone or in person or over telehealth for those one-on-one cessation sessions if they were ready to quit at that point. So not having to go it alone, not having to go cold turkey or have it be, an uncomfortable process, and helping them build some skills that they can universally apply across other things that they might be trying to overcome or change in their life. So it's it's really great opportunity for our clients who might have thought about quitting or even tried to quit in the past. I think part of what I enjoy most is redefining success and what the people I work with think of success. So some of them might quit, some of them might cut down, some of them might just be taking steps towards quitting, but being able to work with them and give them the tools that they need to make those changes, but also knowing that if they have a slip up, that's okay. It's expected. This isn't an easy process. It's harder to quit than it is to never start. So, I really give them all the props for their resilience and starting the next day saying, today I'm going to start as a non-smoker again, and I'm going to treat it as a new opportunity. So yes, I've had people successful in quitting. I have people who I'm still working with, and I'm really fortunate to work with these individuals because it's just such a positive experience all around. They can text 855 891 9989 for support. They could also call that number. And there are some social media sites that they could use at saveyourbreath.New Hampshire, both on Instagram and TikTok.
And I'm glad that you brought up the pandemic, because I do want to make sure our community is aware that we're able to provide services not only in person, but we have remote virtual services available